Okay, so I hope everyone can see the presentation. So, yeah, so I think let's begin. So just as a disclaimer, this is information based on just my experience doing PLAB and coming over to the UK. Lots of changes have happened. So PLAB is supposed to change to the UK MLA exam in 2023. Also Brexit, COVID, you know, there's been so much that's been going on. So, I'll share what I went through and things that I think will be useful, but I'm sure lots more changes will be coming as well. So a bit about me. So I graduated in 2017 from UWI Mona. I worked at Mandeville Regional for 2 years. So that's like internship in my SHO year. And then I moved to the UK in November 2019. I got a job working in oncology as a trust doctor in the south of England. And so that's basically, I'm not specializing, so I'm not a resident or a registrar. But kind of like, I guess in Jamaica, we would say an MO level. And I think that's pretty standard for people moving over to come over at that level. So why PLAB? So firstly, it's a clinical-based exam. The opportunities are not limited to going to England. So I think Australia accepts it, as well as some countries in the UAE. There's a lot less prep time that goes towards doing these exams, and you can start working faster than if you were to go through other exams. I know, especially, I think when people think about going abroad, the main places that they're thinking of are either England or the US. And as we know, US exams take quite a lot of prep work. The lower cost, and I'll go into cost things as well further on in the presentation. And it's a pass-fail exam, so scores do not matter at all. I know that for USMLE, I think step 1 was the really important one, but they've kind of done without scores now, but I'm not sure how that translates. Whereas for PLAB, after I found out that I passed, it has never been mentioned again. You're also allowed multiple attempts, and they don't penalize you for that either. And it's a relatively similar system. I have to Jamaica, but I'm assuming kind of to the Caribbean. And the big thing for me is that there are non-training posts, which gives you some time to come over, explore specialties, see what things are like before you kind of commit to something. It also means that you don't have to wait a whole year for the match process to go around. You can kind of come over in a kind of junior level job and see how things go. And a few cons. So I found that there was less information about the exam process when I did it, which is kind of why I think these discussions are really important, just because I found it quite difficult to actually find other people who'd gone through exactly the same experience. And, there's other persons who might be looking for information, but I found that like a Caribbean specific perspective, there was just information that was missing for me. And it's a longer path to specialization, which is something that people bring up a lot. Difficulty in getting in-demand specialties, which I think is just an issue for most people, for most areas if you want to go to another country. And it's a smaller country than the US. So that means kind of distance in traveling, airfare might be more, far from family. Also, you don't get that choice of, with the US, you can go kind of to places that are more towards the south or towards the north. Another quite like very recent thing is that the USMLE is now accepted for UK registration, which I think if you're on the fence about things and you want all the options available to you, then that makes the USMLE to me quite attractive to go for. And then uncertainty with Brexit and COVID. So there's questions about, you know, the future of the NHS, it's government funded. But I think it's quite difficult to really speculate on what that actually means, you know? And long-term salary potential. So this is a question that comes up as well in terms of how much can you make? And definitely it's a lot more for the US versus the UK. And if you think the UK health system is based more, it runs off government funds, whereas the US is more privately funded. So like a lot of people have private healthcare, and so that kind of contributes towards this being so different. So in terms of salaries, so I know this is often a question that people ask about pay. So figures that I found, so in the US, I found that the average resident salary is about 63,400. Whereas in the UK, there's a bit of a difference. But if we go down to, if you're a doctor starting your specialist training, basic salary starts at 37,000 to 47,000. And that's about the same range. So I know a lot of people have concerns about the pay gap and will you be making less money? But it is about the same. And actually, this is above the average. You will probably be making around about or above the average UK salary. So I think a lot of people have concerns about, will I be able to afford things, you know? And I think if pay is really important to you, then, you know, higher levels, there's definitely a big discrepancy. But training wise, I don't think it's that much different. And then PLAB versus USMLE. So PLAB is 2 exams. The first one is a multiple choice. You get 3 hours for it. And part 2 is an OSCE, 3 hours. Whereas USMLE has 3 steps, but step 1 is split into 2. And they're quite intense exams. So step 1, preclinical, 8-hour exam, 280 multiple choice questions. Step 2 CK, a 9-hour exam, 350 multiple choice questions. And step 2 CS, which I think is the practical one, 8 hours, 12 stations. Step 3, most people do this after getting into a residency program, a 2-day exam, 7 hours the first day and 9 hours the second day. And then time to prepare. So PLAB 1, they recommend about 1 to 2 months, and then part 2 around 3 months. Whereas USMLE is quite vigorous or quite intense studying or preparation to really feel ready. The recommendations that I saw were about 6 months rigorous studying, but I know kind of in practice, I think people tend to spend a little bit more time planning towards it. And when you think about how expensive these exams are and, you know, grades matter, you feel like you really need to get the best out of that experience that you have, then it puts a little bit more pressure on you. Now in terms of cost, so part 1, I mean, I have these in pounds because that's what they have on the website, but in total it's in US dollars about 1,550. Whereas USMLE, $940 US for each exam. And then the practical one is 1,580. So that's about 3,500 US dollars. So a very big difference comparing the both of them. And then in terms of jobs, so it's quite difficult to compare both of them just because most people who do PLAB come over to the UK to work, but not necessarily in a training program. Whereas to go to the US, when you do USMLE, you have to match. You can't just come over and work in the department. So it's quite difficult to compare statistics and how many people get through. But one of the numbers I saw was about, close to 60% of people matched their first time to positions. If we're thinking of international medical graduates, this includes US international medical graduates as well as people born outside the US. Whereas the best number I could find in terms of the data for the UK is about 80%, but I really think that anyone determined enough to come over can. I don't think there's really anything limiting people, and there's many different routes to take as well to come over and start working. So one of the other questions I get a lot is people asking about MRCP. So it's important, I think, to establish, I think these are two different routes that you can take to come to the UK. And I think people think of them as either one or the other, kind of to end up in the same place. Whereas PLAB is basically testing you to make sure that you are competent to work as a junior doctor. So competent to come over basically after your internship. Whereas MRCP is a specialization exam to enter specialty training. So they're both targeting very different knowledge bases and different competencies. So MRCP is a lot more intense. So it has part 1 and part 2, and then PACES, which is the practical exam. And we have the recommended time of 6 months to a year to study for each of them. More intense than PLAB as well, so those exams are a few hours long. But if we look at pass rates, there's quite a big difference in terms of PLAB. So MRCP is known to be really intense. Even UK graduates who've graduated from a medical school here and try it, it's really difficult. So if we look at the difference between UK trainees for their first attempt, almost 60% pass rate, whereas for all candidates, it's about 40%. So I think this is a reasonable thing if you want to come over in specialty training. The other thing is you have to pass all 3 of these exams to become qualified to be able to come over. So I think they're very, very different. I think a lot of people bring it up in the same conversation, like they're the same thing when they're not. And I think it's really important to know what you want out of your exams and what you want to come over to do. If it is that you want to spend a few years studying, practicing, and then come over at a more senior level, then definitely MRCP is a choice. But if it is that you want to come over at a more junior level, basically work as an intern and work your way up, then PLAB is probably the best thing. So the cost, so it is a bit more than PLAB, but if we think that this is a residency level exam, it's not as much as USMLE, and I don't think the difference is that significant. So another question I get is length of training. So of course, training is a lot shorter in the US than in the UK, but I think it's really important to know that there's a big difference in, the society of training and how people feel in their training programs. So comparing the hours of work, so on average, I know that there's a lot said about US residency programs, and they're very, very intense, and they require a lot of dedication, average 40 to 80 hours a week. Um, Whereas in the UK, I think though there's, an emphasis on shorter working hours. So 40 to 48 hours is average, but no more than 56 hours by law, maximum 13-hour shifts. And there's more emphasis on work-life balance. So I think you see more people taking breaks in between in their programs, working part-time, working 80% of the time. So I think those are all much more readily available in the UK and much have more encouraged. And then in terms of my experience, so I felt like UE adequately prepared me for these exams. I felt like these exam PLAB was quite similar to MBBS. And so I felt like I wasn't at a disadvantage. And actually I was at quite an advantage, I found when I was doing it. Meeting people from different medical schools, they all had very different experiences in their preparation and how they went through medical school. And, I met people who said that they didn't do OSCEs, they only did multiple choice exams for the entirety of their medical school. So I felt like the exams were really quite similar to MBBS in terms of a multiple choice exam and a practical exam. The only difference I thought was, learning kind of protocols, laws, and in terms of working over here, there's more resources. So working in the NHS, so of course NHS is government funded, and in terms of the NHS, it's not only hospitals that we think of, but also GPs, community services, carers, and equipment providers as well, and they all work as one team to help everything to flow. If we think about the main aim, so it's government funded, and I think if the government is funding all of these levels of care, really their aim would be to make sure that there's really good community support to reduce admissions to hospital, because it is much more expensive to get someone into hospital for a course. It's much more risky as well. They're going to pick up hospital-acquired infections. Whereas if you can make sure that people can stay at home and be really well cared for there, then that's actually a much more efficient use of money and funds. So of course, funded by taxes, and there's an emphasis on prioritizing clinical need. So I think also it's not as common. I get the feeling that this is relatively common in the US, where you can go to your doctor and ask for very specific things. Whereas here, I think that's not as common. I think people come and there's a protocol, there's a list of things that you have to go through. There's normally like a first, second, and third line medication. And if you're going to the third line for any reason, you have to have a really good reason to justify it. And then just kind of an example. So this is not a specific case, but this happens all the time. As I said, I work in oncology, and I see patients like this every week. And the first time I saw this, I was actually really surprised that this happened, just because this is so different from anything I'd ever experienced before. So we have a patient who's admitted with a metastatic spinal cord compression. So they get an MRI of their spine and radiotherapy within 24 hours of admission. They get assessed by our team. So we have an occupational therapist and a physiotherapist who work on the ward, and they will assess the patient and assess their home circumstances, assess their mobility, assess how they've been affected by things. And then when we're thinking about sending them home, first of all, this process can happen really quickly. You know, there can be reasons that people need to stay in hospital, but if they want to go home, this process can be, you know, can be really speedy. In terms of looking at home, so we can get them a package of care, which can be up to 2 people 4 times a day coming into your home, getting you washed, dressed, sitting out of bed, you know, making a quick meal for you, making sure everything's okay. We can think of a nursing home placement. There's what we call fast track funding. So there's extra funding for patients who are in that last stage of life. We can get a hospital bed put into their home. Home oxygen can be put in within 24 hours. We have hospice nurses who are in the community. So if there's anything that we need to check up on, let's say there's a patient who wants to go home and their pain isn't fully managed, but it's to the level that it's okay for them to go home, then we can get them home and their hospice nurses can take over and adjust their medications. We can get them syringe drivers to give them a 24-hour infusion of pain medicines. There's what we call a just in case pack. So that's a pack of injectable medicines that we can give them in case they end up in problems at home. A nurse can come out and administer that for them. And then also district nurses who work closely with the GPs, so they can do dressing changes and insulin administration. And all of this can come together really quickly at home at no cost to the patients at all. And I think this is one of the things that, you know, one of the reasons why I think that the NHS is brilliant. So I just think that it's incredible to think that you have a system that you can get everything that you need to manage at home at no cost to you. Cost is never mentioned in the equation. And I just think it's an injustice to, you know, charge people, you know, exorbitant fees if that's not necessary. So this is a difference between how things work in the NHS versus in other places. And one of the brilliant things that I love about being over here, but also one of the things that's very different about being over here. And so I think that takes a bit of adjustment. So getting started. So my timeline when I did the exam, so I did part 1 in September 2018, part 2 in March 2019, and then I moved in November 2019. So this is all in the space of just over a year. And I could have done this a lot faster if I was really trying to speed this up. So requirements to book PLAB part 1. So first, evidence of English, and then having completed an acceptable primary medical qualification. So you can't take PLAB during your med school years, you have to have graduated. So proof of English, and I've put down essential. I think, you know, I've seen people get into problems not realizing how important this is, but you have to have proof of English before you're able to continue with your exams. Even if you've been speaking English all your life, you've gone to school, you know, spoken English, speaking English on the wards, you still have to prove that you do. So options. So within 2 years of graduating, you can get a letter from UWE saying that they have taught you fully in English. I mean, I have the price of $1,000 up there and it took 5 days. That was my experience. I don't know if things have changed. So after 2 years of graduating, you can get a letter from your hospital just saying that you work in English, you know, interact with patients in English. And that's probably one of the easier ways to go about it, as long as you've been working at the same hospital for 2 years. And then another option would be IELTS, which is an English exam that you sit. Yeah, not much to say about that. So then signing up. So there's the GMC website. So this will be your portal that you'll use for registration. So, you know, getting all your exams done and getting registered as a doctor, this will be really important. So we'll say, click on option number 2. I don't have a GMC reference number and I want to apply for registration for the first time. And then they'll ask you just a few questions. they'll ask you questions about what medical school you went to, what year you graduated, and then you get it opened. This is my recycled presentation from 2019, so that's why the screenshot is so old. But if you look down the left-hand side, the option, so there's my tests and my registration. So you use this portal to sign up for all of the exams that you'll be doing. So to sign up for PLAB, you would go through this. And then to register as well, you'd go through this. So PLAB 1. So some of the questions, I got some questions before this just to get an idea of what people wanted to hear from me. And so I have here, best time to do it is ASAP. So I think there's no real, as long as you've graduated medical school, there's no real timeline that you need to follow. But I just think doing it as soon as you've graduated, basically, or as soon as you want to. As I said, this is a junior doctor exam. This is to prove that you are at the level of an intern. And I think actually, if you wait for too long, not that it won't be manageable, it might be quite achievable for you to do it, but I think that it's difficult to break out of the shell of working in a senior role if you're used to that. So in those exams, especially in the practical exams, they expect you to do what a junior doctor would do. And if you are used to making decisions at a senior level, then it might be really difficult for you to step back and say, okay, I'm not going to make that decision because I'm not in my level, even if it's right, I'm not supposed to be making that decision. I'm going to discuss with a senior. I think you get ingrained into the practice of working in Jamaica, whereas working in England is so different. So it's similar, but it's different at the same time. So I think as soon as you want to, basically, is the best time to do it. So I have PLAB 1 is held in the UK 4 times a year. There's multiple locations that you can do it. The suggested study time is 1 to 3 months. I think I probably took about 2 to 3 months to study for it. And then question banks. So there's lots there. There's lots of study courses available as well. I used Past Medicine. And yeah, I think I probably took about 2 months just going through the questions. And then PLAB 1 consists of 180 questions in 3 hours. It mostly tests clinical knowledge, and most of the questions are from internal medicine. A few are from surgery, peds, obs and gynae, etc. And when I did it, most of the questions were best initial management. What's the first thing that you would do in this situation? So I felt like it wasn't a lot of questions trying to trip you up, or questions that would say, you know, like person A presents with this disease, but they don't mention what the disease is. And then they say, okay, now tell us what is the treatment for this disease, where you have to go through multiple steps of figuring out. I felt like they were quite straightforward questions. And then what is the UK MLA? So this will replace the PLAB exam in 2023. So it's going to be 2 exams, just like PLAB. So the first part will be the applied knowledge test. It will be the same for both UK and international graduates. And it will most likely be a computer-based test. And then there'll be a clinical test afterwards, focusing on practical aspects. I think it's difficult to know. I think most people's question is this going to be harder? How different will this be? And it's difficult to know. There's not a lot of information that I could find on this. I think it's reassuring in a way to know that you'll be taking the same exam as UK students. I think that will make it a little bit more streamlined if they're trying to get in the habit of everyone having to take the same exam. But I think there's just a lot of unknowns and we don't really know what it all means. But what I could find was this is kind of a guideline as to how they plan to assess students when they put this exam into place. And I think it all looks fairly straightforward. It still looks really heavily clinical. So I think that's the good thing. And then looking through, I think that going through medical school should prepare you for all of these things. The only thing that I think is really important to know is areas of professional knowledge. So like medical ethics and law, very, very different from in the Caribbean, and also very, very important to know. So I brought this question the last time I did this presentation, and I'm just going to repeat it. So a 14-year-old girl attends her GP surgery requesting the oral contraceptive pill. She's sexually active and her boyfriend is in the year above her in school. Her parents are unaware that of her appointment and her request, and what's the most appropriate action. So going through, surprisingly, the answer is A, advise her about safe sex and prescribe the OCP. And there's something called a Gillick competency that means that children, not teenagers, are found to have competency, so they are able to make these decisions for themselves without their parents being involved. And so that's what I mean about the legal side of things being really important to know. And I think this is a question that you wouldn't really guess the answer. You wouldn't really know what to put unless you had specifically read up on these things. So visas. So I'm not sure in terms of in Trinidad, but for Jamaicans, we would need a visitor's visa. So for a 6-month visa, I found that it's $170 US, so not too bad. So when I went for my visa interview, you don't even really speak to someone, you just hand in the documents, and you don't need to book your flight before, just proof of funds, proof of a job, and basically print out your plan that you're going to sit PLAB 1. I found that because it's just a multiple choice exam, I felt a little bit less stressed about doing it. I felt like it was a bit more straightforward. And I think I just flew over for a week and did it and came back. And I put here, print application to ensure consistency. I found this helpful because I kind of applied for multiple visitors visas and then eventually my visa to work here. And I just wanted to make sure that everything I put on those visa applications was the same as it was before. So PLAB 2. So requirements, just that you pass PLAB 1. So this is held in Manchester. So again, when I was doing it, things were really different. They were refurbishing the Manchester site, so they had other sites open. So there was a site in London open, and I actually did mine in Cambridge. So 18 stations, you must both pass a minimum of 11 stations and pass a minimum score, which I think is marked on a curve, so it's different for each one. So in bold, I've put, I highly recommend attending an academy. I think this is a bit difficult now with COVID and restrictions and not traveling. So it's a bit difficult to know what to recommend or what to do. But I think in terms of interactions, there's a really big emphasis on, so I think definitely in Jamaica, and I'd say maybe in the Caribbean, there's quite a paternalistic view on healthcare and visiting the doctor. And so I found that most of my patients would come in and they'd say, oh, well, you tell me what you recommend, like, you know, whereas working in the NHS, and I guess it's also that I'm working in oncology as well, that patients have a lot of, they're very educated about their disease and they have views on the best treatment. And I find that consultations are more of a discussion rather than the physician clearly leading the way. So, you know, it's also just a much more relaxed environment when you have consultation. So for example, one thing that I found really unusual is that most people introduce themselves by their first name. And I guess I also work kind of more in a more rural area. So this isn't saying that this is the case for everywhere, but my first day on the ward, I came and, all the consultants introduced themselves by their first name, and all the junior doctors. And when we spoke to patients, so I would introduce myself as Stephanie or Steph instead of Dr. Mullings. And I think that is a lot more standard to kind of try and break down those barriers between people, but also just very different and very difficult. Well, just something to get used to. So this was me at my academy when I went, and I had a great time, which is why I think that everyone should go to an academy. So in PLAB 2, each station will be assessed based on your performance against the 3 marking domains, and these are all marked evenly across the domains. So there's data gathering, technical and assessment skills, clinical management skills, and interpersonal skills. So if we think about it, if all of these are marked evenly, then interpersonal skills is a really important thing to focus on, because that can really tip you over the edge. And also just getting used to the expectations that people have when you are in a consultation with them. It's more than just saying one hard line at the end of, oh, I'm sorry for your pain, or it's more about understanding that person and, really feeling for them when they tell you about their situation, really listening to them when they tell you their concerns. So I have an example of a question. So a 5-year-old boy, James, was brought to the hospital feeling unwell with a rash. He's been diagnosed with meningococcal septicemia. He's in ITU receiving oxygen, IV fluids, and antibiotics. Please speak to the mum and address her concerns. So I think based on what I knew before, if I went into the station, I'd say, right, so I need to hit all the marks. I need to be able to explain meningococcal septicemia. I need to explain why he needs the oxygen, why he needs the IV fluids, what antibiotics are we using. Like, I need to prove to them my clinical knowledge in this situation. Whereas for PLAB and how they want you to interact with patients, actually, the main thing that should jump out to you is, please speak to the mum and address her concerns. Really, you shouldn't be the one doing most of the talking. The mother should be doing a lot of the talking, and she should be leading the consultation. So when you go in, it's not about rushing in, and because they don't need to know. You've already proven in part 1 that you know clinical knowledge, you know how to manage cases. What they want to know is, are you understanding on the ward? Are you able to put people's minds at ease? Are you able to discuss all of this with them? So the mother should be the one leading this consultation. And oftentimes her concerns are very specific, and the actors will be taught to, only let this detail slip after you've asked a certain question or after you've said a certain thing. And so I think oftentimes the whole point of a specific station you might miss if you end up continuously bombarding her with medical information. So after we've done part 1 and part 2 is EPIC verification. And I think this is the same for the US as well. So this is just to verify your medical degree. The process took about 2 weeks for me, and I have a few fees there, but that was from my journey, so that's probably outdated. Really, they collect your documents, and then they verify with UE that you actually graduated when you did and that this is real. So you pay them a fee, and then oftentimes you pay UE a fee as well, just to verify that the information you supplied is correct. And then GMC registration. So once you've done all of that, you've done your exams, you've verified everything, then you send everything to the GMC. So passport, MBBS certificate, verification, certificate of good standing, which you should get from the medical council, evidence of your knowledge of English, and evidence of internship. Now, this is one thing that I would say will just make your journey so much easier. is just to do your internship in the country that you're studying in the way that it's lined up. So don't take a break in before internship. Just complete it, because I think that will just make GMC registration so much easier. If you do have a break, it doesn't mean that you can't get registered, but it just means that you'll have to explain why, and it will be just a little bit more information and more a longer step to go through. And in terms of internships in the UK, I think that's a question in terms of, you know, if you're really, really eager to go over, but it's really, really difficult to do internships in the UK. I think because they have all of their UK graduates who need to do internship. So it's really, really difficult to get a slot. So just do it in the Caribbean. I think that's the only year that you really have to do, because it is feasible to do these exams during internship or even a little bit after. And then you can go over and start working. It only took about a week once I submitted all my forms, and it was £153. And then the job hunt begins. So I think there's kind of 3 different ways to come over. So there's what they call a Foundation Year 2 standalone job. So you would apply for that. They do an interview to give you the post. And I think that's useful if you come over really early. So if you only have 1 year experience in Jamaica and you want to start kind of at the lowest level, it's also good if you want to get quite a competitive training post, just because that means that you have a lot more, it's very structured how they do it, because it's basically like a second year of internship. And so that's really useful if you're trying to go for something really competitive. The way that I went, and I think most people go, is a trust grade job. So just trying to get a junior job on the ward, which are normally available in lots and lots of different areas. Sometimes you can have arrangements where you rotate through the different areas, or you can go in for a training post. So I think it's a little bit more difficult to get a training post, especially from the Caribbean, not having any NHS experience. It's also just difficult, I think, moving from one system to the next. I think your qualifications don't always perfectly line up. Your experiences don't perfectly line up, and it can just be a little bit difficult. I found when I was going through this, even finding references that had like official email addresses linked to their jobs, and not like a Gmail email address that I'm putting down. I just think everything is a little bit more official once you've been working in the NHS for a while, and you have contacts who can vouch for you. So as I said, I would recommend starting with a non-training position. That's the route that I took, and I think that that's the best way for me. I think there's more scope for part-time or varied work arrangements once you come over here. So I don't work weekends. So I just work Monday to Friday, 9 to 5, 40 hours a week. There's also jobs where you can do 5 days on and 5 days off, or lots of different kind of varied patterns that you work. Going through NHS jobs or track jobs are 2 websites that you can look at the different jobs. And then this is kind of different depending on the circumstances. But I found like 1 to 4 months of job hunting, and then 1 to 3 months of kind of pre-checks and visa processes before you're able to go over. And then immigration. So the trust will file for what they call a Tier 2 health and care visa. And this is a new visa that just started pretty much before I applied for my last visa. The cost is £232, which is a lot less than it used to be. And then the way they do it, which I found very strange when I started, is that they will actually give you a 1-month visa to enter the country. And then once you're here, then you'll get what they call a residence permit, which is a little card that basically says that you are able to start working. So there's something called the NHS surcharge, which is a fee that everyone immigrating to the UK had to pay, basically as an extra charge to use the NHS, mandatory, you couldn't get out of it. So now that they have the health and care visa, you no longer have to pay the NHS surcharge for you or your dependents. But I just mentioned it just in case anyone, you know, knew someone else who was coming over on a different visa, they would probably have to pay, and their visa fees would probably be a lot different. They've reduced the fees based on kind of a response to COVID and trying to encourage people to enter the NHS. So this might be another thing that changes as well. And then to optimize your chances to come. So I think it is a process that you're not really able to start until you finished medical school, which I hope doesn't make people feel too kind of stuck. Like you know you want to do this, but you have to wait a few years until you finished. But I think in the meantime, some things that will always reflect well on you, to do any research, to do any presentations, any leadership opportunities that you get, any opportunities to go up and do an observership or an elective in the UK, I think is always really useful. If you have any friends, mentors, or colleagues that work in the UK, and just keep up to date with changes, because there's lots of changes. Everything has been changing recently. And I'm sure even when you all manage to do PLAB, if you choose to, things will have changed. And so good luck.
So I thought, hi, Dr. Mullins. So I don't know if you guys could see me. I'm not sure. Okay, so I thought that was an amazing presentation. So well done. I think you really covered the entire, you're welcome, the entire sphere of PLAB, from before, during, and then after, and then navigating into the NHS. I think everybody, like from the chat here, everybody, you know, would have found it really beneficial to them. And I think you did answer majority, if not all, of the questions that everyone would have sent. But if there are some questions that persons have, you can definitely ask Dr. Mullings. You can send them in the chat, or you can just, you know, put on your mic and ask.
Hello, good afternoon. You guys
Hello.
hearing me? Hi, Dr. Mullins. Just a few questions from me. First one is, why did you choose to do PLAB 1 in the UK versus the other sites? Is there a specific reason for that?
Well, so the two closest sites are Canada and the UK. The other ones are kind of the other end of the world. And it was a lot easier for me actually when I was kind of, part of the reason why I came to the UK is because my partner lives here. So it was kind of like any reason to come up here, I was more than happy.
Okay, then, so that answers my next question then about housing. And if you, is it a case where you already knew where you were going to stay and those things? So for those of us who, say for example, somebody who has never been to the UK and does not have any relative or friend or anything, how would they be able to arrange housing after they get the job and everything?
So after you get your job, normally there should be housing kind of nearby the hospital. Actually, that's an interesting point to bring up. When I got my job, they sent a really long kind of welcome email of lots of different things. And one thing they sent was that there's hospital accommodation. So I wrote to them really happily, being like, I got this job, I'm ready, I'm coming from Jamaica, I'm ready to get my hospital accommodation. And they emailed me back saying, there's nothing available, basically. So I think hospital accommodation is oftentimes for people who are doing really short stays. So you have lots of doctors coming and doing locum work. So they might be in the hospital for maybe 2 weeks, maybe a month. But normally there's areas nearby. I just used lots of websites. There's one called Zoopla. When I came over as well, I at first was in a house share. So it was a couple who had an extra bedroom that were, basically letting it out. And that's what I did for the first few months because I was going back and forth to London and I didn't really want anywhere too permanent. And then COVID hit and everything changed and I got my actual house. But it's a lot of kind of looking around. Normally there's people in the hospital that can help a little bit, people in your department who might help you look. But yeah, just a little bit of luck in finding something.
Okay, so it's just you have to do your research and find somewhere.
Yeah.
Okay, so my last question is regarding the final visa. You said that it would be the actual employer that gives you the documents for the tier 2.
Mhm.
Okay, and you had therefore it's 3 different. You said you had multiple visitors visa because you have to go for PLAB 1, you have to travel for PLAB 1, then you traveled for the academy, which is at the same time as PLAB 2, like close to the time that you would. Oh, so it was just one flight, then not 3 different times.
No,
Okay.
no. So I did my academy and then my PLAB part 2 within the same trip, which I think is the best way as well because then everything's still fresh in your mind.
Okay, thank you. That's it from me.
So we do have a question in the chat. Somebody asks if you can choose where you want to work under the NHS.
Yeah, so in terms of kind of trust grade jobs, which is what I'm doing, then the job will be very specific. So it will say job in this department in this hospital for this amount of time. If you're applying for a position like to specialize, then normally you'll apply to specialize to a specific trust, and they can send you around the trust to different hospitals. So if you're specializing, you have less control with where you'll end up. Whereas if you're kind of just coming for a junior post, then it's a lot easier to get a really specific place.
Okay, thank you. I think, correct me if I'm wrong, but Nakisa had her hand up for a while now.
Yes, hello. Can you guys hear me?
Yeah.
Okay, so it's just me trying to understand the process. So correct me if I'm wrong as I go. So you graduate from MBBS, you do your MBBS, you graduate and you do internship, right?
Mm-hmm.
Then after internship, that's when you sign up for the PLAB online.
Well, you can sign up after you graduated. So I did this after internship, but you can do this during internship as well. You just have to have graduated first.
Okay, so I could study first. So what I had to ask next is that how long between registering and the exam itself?
So it just depends on availability of the exam. So once you've registered and filled out everything and have your kind of GMC login details, then you can just click on and see what exams are available. I think things are a bit different now with COVID. There's quite a long wait for part 2 exams just because they were on hold for a while. But on the portal, it will come up with all the available exams and you can just click the one that you want.
Okay, and last question. So you've done PLAB 1 and you've done PLAB 2 and you're good. So that's when you go to the NHS and start looking for where exactly you have to work?
Yeah, so after, so you do part 1, you do part 2, register to get your GMC number so that you're a registered doctor. But at the same time, you can look at jobs that are available.
Okay, thank you.
Okay, so Dr. Mullins, if you can look at the chat, there are a lot of questions here. So someone asked if the PLAB exams require you to physically go over to the UK to complete them.
So part 1, there's other areas that you can go. So like Canada, and there were some other sites as well. But part 2, you have to come to the UK. And I think they're only done in Manchester now. So you have to go to Manchester to do that.
Okay, thank you. Someone asked how long does training in the academy take?
Oh, well, there's different programs. I think mine was just 3 days. So I found it really, the one that I went to, I found really useful because I think it was just 3 days and we just went through like mock OSCEs. And so we were in smaller groups and we just did kind of OSCE after OSCE after OSCE. I think some of them have different ways of doing things where they can have a teaching aspect to things. But I think if you've managed your way through MBBS, actually the knowledge part is fine. You should be fine on clinical knowledge, especially because you won't be expected to manage very difficult cases. They just want to make sure you're at the competent level of an intern. So really what I found the academies useful for was just in terms of how do you interact, you know, with a British person in the NHS. What do they expect of you? How do they want that interaction to go? How should you present your information? Just those kind of details to get those interpersonal skills right. And also I found it useful to see different people with different accents as well, because they, you know, will put different people in almost to, not to throw you off, but it can throw you off a little bit if you find it really difficult to understand what the person's saying. You have to ask them to repeat a lot of times.
Okay, so just one question relating again to the academy. Someone asked, how do you find a suitable one?
So I went to one called Bromley, but I basically so there's a lot of Facebook pages for people doing PLAB, which I found really useful even before booking into an exam, just to see the kind of things that people are going through, and their different experiences that they post. And so I basically just went on the Facebook page and found the one with the least kind of complaints on it.
The power of social media, yes. So, I'm gonna give the floor. Gonna make a switch. Sunita had her hand up. You can go ahead.
Yes, good afternoon. I was wondering, I'm not too clear about the internship. After you graduate from your medical school, whichever one you are, is it mandatory to do an internship before you apply for the exam? And what's the minimum time to do the internship?
Oh, well, it's mandatory to do an internship before registering. So you can do your exams during internship. You don't have to have that. But to register as a fully qualified doctor, you have to have an internship. And I think the rules that they say is it has to be at least 1 year long with at least 3 months of medicine and 3 months of surgery. I think it's 3 or 6,
Okay.
whichever way they do it, our internships meet those requirements.
So we have to register, you need to do an internship, but to write the exam, you can do the exam anytime after you graduate. Got you. Okay, thanks.
Okay, so now ZH had his or her hand up, and then Candice can go after that.
Hi, Dr. Mullings.
Hi.
I saw you mentioned FY2 and trust grade jobs, and you're in oncology.
Mhm. Yeah.
So is it that for the trust grade jobs, you requested to do certain specialties to give you experience in them before you decided to enter oncology?
So I'm currently in a trust grade job. So the way that they advertise it, if you go onto, there's a website called NHS Jobs, and it's just job adverts. So they will advertise and say there's a 6-month position at this hospital in pediatrics, and basically kind of apply if you're interested. So it's not a part of a training program. It's just a job that you can enter. And I think that's the way that most people come over to the UK, is to get one of these kind of junior posts, because you can apply for a training program while you're in them. And at least it gives you contact in the NHS that you can use, references that know you, and a feel of what it's like working over here.
Oh, okay. So that would be kind of similar to medical officers in
Yeah.
Jamaica then.
Yeah.
Okay. So what would be the benefit of doing FY2 over the trust grade job?
I think one benefit is, I think one of the good things about the UK process, compared to from what I've seen of the US process, is that I think they put a lot of emphasis in your clinical work and what you have done since graduating. So I don't think medical school matters so much. So I think some people want to come over in a really junior position, and then you can kind of maximize on your experience. You get kind of the feeling of being in a proper internship, a very structured internship. They have goals that you need to meet. They have things that they'll push you to do. So that's an option if that's what you want to go for. But I didn't. I just took a trust grade job.
Oh, okay, thank you. Because I heard something going around that after you do PLAB, you have to do some 6-month session. I don't know if it was core training or something like that, but I was just confused. But once you said you were able to do a trust grade job immediately after going
Yeah.
up. Okay, great. Thank you.
Yeah, I think, I'm not sure about the 6 months. I know that for some jobs, especially if you're going into a more senior position, sometimes they will have like an observation period before you're actually able to do your proper job. So you might be on the ward for like 3 weeks as an observer, or they might have you working at a junior level for a month before they've decided that you're competent to step up and work at a more senior level. So I'm not sure if that's what they meant by that, but if you want a job, you can, just apply for one and come over and start working.
Okay, thank you very much.
Yeah.
My question is, what is the weather like overall?
Oh my gosh, crazy. So yeah, I live in the south, which is supposed to be kind of have nicer or milder weather. It's supposed to be less cold, but I'm still freezing. And actually, it's just so unpredictable. So 2 weeks ago, it was bright sunshine. It felt like it was about 20 degrees. I was like, oh my gosh, things have turned. We're looking forward to summer. This is amazing. And now this morning, we had a really heavy hailstorm. So you just don't know what you're going to get.
Oh, okay. Thanks.
Hi, Dr. Mullings. I have a question that was directed. This person is asking, is internship in the UK impossible or just difficult to get?
I haven't really looked into it so much, but I do know from all of the kind of discussions and things that I've seen that normally people are heavily discouraged from trying to get internship in the UK. I think it's, I don't know if it's possible, but it's very, very difficult.
Thank you.
Okay, so I'm gonna go back to the chat. Someone asked, this is their question. I was told foreigners need to do 2 years as a GP doing psychiatry or research before specialized training. Is this true?
No, I don't think so. I think it's a little bit confusing because so in the UK they don't use the term GP as kind of a doctor who's finished. Like you have to specialize in GP to become a GP and be able to work as one. Maybe by the 2 years they mean there's the foundation years, but I don't think there's any kind of mandatory period that you have to work for.
Okay, thank you. So we have another question here. So this person wants to do the FY1 in the UK, and they're asking if they need to contact the hospitals or the universities, and if they need to do some kind of exam in order to apply.
I'm really not sure. I'm so sorry. I didn't really look into it that much. I know that it's really difficult to do. So they normally recommend that you try and do your internship in the country that you are. And then it's a lot easier to come over after that. So I'm really not sure what the process would be.
Okay, so there's another question here. I really like this question. I would love to know the answer too. So how was the adjustment to life in the UK? And how do you think this varies by area? What has been your experience of the perceptions / attitudes of British patients / workers towards immigrant doctors?
So my adjustment, well, I think I'm quite lucky that I have people who I knew over here before I came. So in the department that I work, there's 2 other doctors who came over at the same level that I am, from different areas. And I think it's quite difficult and quite lonely moving over and not knowing anyone. And then of course, COVID and lockdown, can just make you feel even more isolated. I think my experience is a bit different. I came to this area in the south, which is quite rural and not very diverse. So in the department, I think there's 2 of us as Black people and 1 Indian person. But in my interview, I remember I asked them about diversity and they said, oh, we have 1 doctor from the Ukraine. And I thought, is that diversity? Okay. In terms of attitudes towards immigrant doctors, I think everyone's been kind of politely curious about me. But I think that people aren't very, people in England are very polite. So I don't think people will really say anything to kind of like, they won't just like come out with anything that might be too offensive. I think they might ask questions that, if you think about it, doesn't really make much sense. But yeah, I think that so far I don't have any concerns. I don't think anyone's been particularly, I think it's like everywhere you come, you have to kind of prove yourself to the team that you know what you're doing. But I think everyone I feel quite accepted in the area that I work.
Well, I'm really happy to hear that you had such a really good experience.
Mm-hmm.
I saw Carla Anderson's hand up. And not sure if she
Hi.
still wants to ask her question. Okay.
Sure. Well, it would be a second question, but thank you for the talk, Dr. Mullings.
Thank
And
you.
so my question is, how many years on average does a foreigner spend in a junior post before they are successful in getting into a specialty training program?
Well, so
Say I'm interested in radiology. If I
Mhm.
were to come to the UK, how long would I have to stay in a junior post before I can specialize? Or how long would it take me before I would get accepted into a specialty training program?
Well, so it's a bit difficult to put kind of time frames on things. As you said, for radiology. So I know there's, specialties that are a bit easier to get into. And so that might be a few months, kind of the next time the cycle comes around, just apply and then you get a position. In terms of radiology, I'm not sure. I think a few years. I think try and get a junior post in that area, or just a junior post in a big hospital, and kind of voice your interest and see if there's anyone that you can meet down there, who might know of more opportunities, and yeah, just try and kind of boost your resume in that area, but I'm not 100% sure.
Okay, so you wouldn't be able to give us a specific timeline, or say it is longer than normal, or is it longer than say a UK foreigner? Would it be more difficult for us? Well, obviously, right? No, yes.
Yeah, so I'd say probably a bit more difficult, but I think once you're in the UK and working in the NHS, that already gives you kind of a leg up. And then I think just kind of take it from there, but I'm really not sure about the process and how long it would take.
Okay, all right, thank you. All right.
Okay, so moving on to the next question. Someone asked if you heard about working in Australia or Ireland.
Yeah, so I know that once you've done PLAB, you can use that to register to go to Australia. But I think it's quite difficult to go to Australia. I think the job market is quite saturated, and I think that is a lot of people from the UK go to Australia either for a short or long term to work, because it's better conditions, better weather, more pay. So you can use it to go over, but I don't think the job market is it's not as straightforward to go over there as it is to come to England. In terms of Ireland or the Republic of Ireland, I'm pretty sure they accept PLAB, but they have a bit of a different system. So I think it's like a different website to apply through. So it might be a little bit different than what I've described to go over.
Okay, so someone asked what resources you used when you studied for PLAB 1.
So there's a website called Past Medicine, and that just has a whole question bank. But there's also, I think there's a question bank by the BMJ. There's one called Plabable that people swore by in Facebook groups that I saw. But I think I found PLAB 1 so much more straightforward to study for. I think in terms of the questions, they're quite similar to what you'd expect to be asked in MBBS. And so I think I found it definitely more straightforward to study for PLAB 1, because as long as you are doing relatively well on the question banks, then that should reflect how you do in the exam.
Okay, great. So I think this question is more for the Jamaican students, but someone asked, since the SHO is 2 years now currently for us upcoming doctors in Jamaica, do you think it's still possible to do PLAB before it's replaced with the UKLMA?
Well, I guess it depends on when you graduate, but it's really as soon as you graduate, basically, to do it. I think it's coming in 2023, so we have a little bit of time, but they're also quite backed up with part 2 exams. I know a lot of people are waiting on exam slots for part 2 because they stopped for a while because of COVID. So there might be time, but it's really just doing internship that's the important part. I'd say even if you get your qualifications halfway through SHO year and you want to leave, then no one's stopping you, basically.
Okay, awesome. So let's say you've been a physician for several years, like 3 to 10 years, right? How difficult is it for the GMC to accept you?
Not difficult at all. You can go through the same process if you want to do PLAB. If you feel like another exam is better for you, then that's fine. But there's no issues with how long you've been practicing before. If you have any gaps in your qualifications, the only thing is you just have to explain them. So if you took 2 years out when you got pregnant, or they're quite understanding. So I've seen situations of people who've said, I practiced medicine for 2 years and then I took a break, and 10 years later I want to do PLAB and I want to start practicing, and they managed to get qualified as well. So no matter how long you've taken, you can still do PLAB and you can still come over.
Okay, great. So I see Rajiv has his hand up, so I'll give him the floor.
Okay, so firstly, thank you so much, Dr. Mullings, for giving us such a comprehensive talk. My question is with respect to the time. I know you spoke about needing to graduate first before actually going about the process. And does graduation count as the letter that you will give saying that you have passed your final MBBS exam, or is it certificate itself that you need?
Mm-hmm. Yeah, so just the letter is fine. As long as you have that letter saying that you finished, that you've passed MBBS, then that's enough to sign up for your exams.
Okay, I see. Thank you so much.
Yeah.
Okay. So this is a pretty lengthy question. So you said getting a junior job and specializing are different. So let's say you want to specialize in neurosurgery. Can you get a junior job in that field, or would you have to get a junior job in general surgery first?
No, you can get a junior job in neurosurgery. So, just go into NHS jobs, type neurosurgery, and then things will come up. You might have to wait a while if you're waiting for a really specific area of medicine or a very specific area of the country. Of course, it's a bit more competitive if you want to go to somewhere like London versus somewhere basically anywhere else outside of London. But there are junior jobs in neurosurgery, so you can go for that first, and at least you can get contacts. You can slowly, build up the things that you've done, maybe do a few presentations, and then apply after that, once you get a good idea as to what's required.
Hi, Dr. Mullings. So a few other persons were asking questions about the situation right now. Is there a shortage of doctors in the UK? And someone else asked if you have a spouse that wants to come with you while you work, how difficult would that be?
Okay, so in terms of, is there a shortage? So there is a shortage, but it certainly didn't feel like it when I was applying. So when I was applying, I applied for around about 100 jobs before I got this one. But I applied for another job having done this one, and that was the first other application that I sent out, and I got that job. So once you have NHS experience, then it's like all doors are open and it's a lot easier to move around to different areas. So yeah, there is a shortage, but I think it's a bit more difficult if you're coming from outside of the country, because it's just a bit more difficult to prove what experience you have. You know, when I was doing the job applications, there were sections that I didn't really know what to put. When they asked about my competencies, I've never had that signed off, so I don't, you know, I put stuff that I knew what to do, but it's not the same as when you're coming from another, you know. And even when I did that interview, they only asked me about my previous NHS job, nothing else. So it's, once you're in the system, it's a lot easier. And there is a shortage, but it's not like they're absolutely desperate. It doesn't mean that all doors will be open and it will be such an easy and simple process to come over. And then in terms of bringing other people with you, so I think, so first of all, you can bring kind of dependents over with you, but dependents are your spouse or your children, so not your parents. So in the US, I know a lot of people go to the US, get their citizenship, and then bring their parents over with them, whereas that's not possible in the UK. You can bring your spouse over with you, but I think there's kind of limitations in terms of, if I don't think they can work on a spouse visa, they just have to come over and your pay has to split between the two of you. But it's not difficult. I think once you know, probably just once you get your job, go through the visa process, just list them as a dependent. And it shouldn't be difficult to bring anyone over with you.
Okay, thank you for that. One final question. Someone is asking if you've ever worked or considered working in private practice, and do you think it's difficult to do so?
So there are private hospitals that you can get jobs with. I think it's a bit different because, of course, I went through NHS jobs to get my job. In terms of private work, it's a bit different. I think in Jamaica, we're used to a system of, you know, you have the public hospitals, but you have private GPs and private hospitals, and you can just go and they're quite busy. Whereas here, most people use the NHS. So private practice is quite different and not that many people do it. If you do want to get a private job, then, you know, I think there's just kind of channels that you go through. So like recruiters that can put you in touch with people who have a position for you to go in, and you can make a lot more money that way. But also I have seen kind of stories of people who end up in jobs with no progression, not much teaching. You're just kind of put in this position and you're doing your best, but you know, you don't have that like really good senior guidance and leadership, and you don't feel like you're progressing. I think once you enter the NHS, then there's like a very clear stepward progression and there's a lot of resources around you. Whereas I think if it's your first job and you're in a private hospital, it's not always as supported as you'd like to be.
All right, thank you so much. Guys, it's been really good having everyone come out. I want to say thank you to TTMSA and all the students at Mona and WJC who came out. Dr. Mullings, thank you so much. You've been so wonderful hosting us for so long. And
well,
all the
thank you all
questions.
so much. I did not expect this many people. I'm really surprised. But I'm really happy I could at least be useful to someone.
I think we definitely, especially in this time, appreciate you making time for us in the midst of Zoom fatigue. I also wanted to just say a quick thank you to all of the persons who helped to put this on. Adila, you did such an amazing job, by the way. Just woo! And also members of my SCOME JAMSA team, my PRO Satya, who though she's not with us in person right now, she's in TT. You know, she did her best to help out with this as well. also the VPI from TTMSA and the SCOME subcommittee at TTMSA. Everyone, thank you so much for coming out, and we are making this recording available for those who had any connectivity issues or had any problems falling, in and out, as it were. But thank you again, everyone, for coming out. I'll see you guys at or USMLE and all those.
Thank you, Dr. Mullings. Much love from TTMSA.
Oh, thank you so much. You've been really, really helpful. And it was my pleasure to come and talk to anyone.
Awesome.